Agrylin is a medication that contains the active substance Anagrelide. Anagrelide is a platelet-reducing agent used in the treatment of certain blood disorders, particularly essential thrombocythemia. Indications: Agrylin is indicated for the treatment of essential thrombocythemia in patients who are intolerant to or not responsive to other treatments. How to use: Agrylin capsules are taken orally with or without food. The capsules should be swallowed well with a glass of water. The dosage of Agrylin is individualized based on the patient's response and tolerance. The typical starting dose is often lower and is gradually increased as needed. Dosage adjustments are made under the supervision of a healthcare provider. Contraindications: Agrylin is contraindicated in the following cases: hypersensitivity or allergy to Anagrelide or any components of the medication, severe liver impairment. Special instructions: use Agrylin with caution in patients with a history of heart conditions, as it may cause tachycardia, increased heart rate. Agrylin should only be used during pregnancy if the potential benefit justifies the potential risk to the fetus. It is not recommended during breastfeeding. Regular monitoring of blood counts and liver function is essential during Agrylin treatment. Adjustments to its dosage may be made based on these monitoring results. Side effects: common side effects of Agrylin may include headache, dizziness, nausea, diarrhea, palpitations. Serious side effects may include cardiovascular events, bleeding, and changes in liver function. Any unusual or severe symptoms should be reported to the healthcare provider promptly.